What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or maybe a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, February 25th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and each one of them do come with a risk to you. Hey, COVID, it can go on to cause long-term issues. I myself have had COVID at least once, if not twice, a suspected case back in 2020. And then at the end of last year into the very start of this year, had a confirmed positive case of COVID with rebound, and here we are today. I still do have issues from COVID. More on that in a little bit. So, yeah, you need to be informed with what's going on with these viruses. A lot of people are sick this winter. Want to stay informed? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. We do have several news stories to talk about today. And we do have some of our daily data. A couple weekly items. We're also going to take a look at Walgreens again, Wastewater, and some CDC hospital capacity data is what we are going to look at today. But before we get into today's update, I do need to give you some news and notes. First off, tomorrow, you may see the update come early. That is because I have a telemed doctor's appointment. Remember my headaches and, well, fatigue issue that's ongoing as well? I do have a telemed appointment tomorrow. There's a rather large window. It's in between, I think, 2 and 7 tomorrow. So, in lieu of that, we may do an update early tomorrow. Also, important note, it is possible we do miss a day next Tuesday because I'm going to have an MRI done on my brain for the headache issue that I have been having. So I wanted to make you aware of that in case we do happen to miss a day going forward. I don't think we will, but just be aware that tomorrow's video will be early, and Tuesday either will be an early video next week or no video at all. All right, starting off today in Texas with measles. The outbreak grows to 124 cases, mostly among the unvaccinated, and it looks like children and teenagers between ages 5 and 17 make up the majority of the cases. And the epicenter of this is looking to be in Gaines County, Texas. So again, this is an increase. This is an increase that we are continuing to see happen. Would not surprise me if it happens again later this week. Remember, just a couple weeks ago, it was 1 case, then it became 2, 4. It's been multiplying. It's been multiplying rather fast. So Texas measles cases up to 124 now. And here's the update on the Pope. I thought I would add this in there today. Pope Francis remains in critical but stable condition in the hospital, Vatican says. As you know, he has had pneumonia, and then his kidneys have been infected. I did see yesterday he was doing some of his phone calls, so he was doing some work. I guess that's a good thing, but at the same time, he needs rest. If you can, just say some prayers for the Pope. And I'll be honest with you, I do know some people in my personal circle that are dealing with similar issues right now. Please say prayers for anyone who's dealing with pneumonia right now. Pneumonia it's not a good thing whatsoever, especially double pneumonia, which is really bad. Listeria outbreak impacts long-term care facilities in Illinois and 20 other states. Yeah, this is not good. A listeria outbreak tied to supplement shakes has sickened more than 36 people in 21 states, including Illinois, according to a press release from the Centers for Disease Control and Prevention. The outbreak started 7 years ago, though a majority of the cases have occurred within the last 14 months. So, looks to me as if this has grown significantly. At least 38 people in 21 states, including Illinois and Indiana, have been sickened by the foodborne bacteria illness. Of those, 37 have been hospitalized and 12 have died. I'm going to be making a thread today on the site for all the news stories. I didn't do one yesterday. Sometimes I just don't have the energy to do that. Or I end up going to sleep early and I don't get to it, and I'm already trying to find things for the next day, so I'm like, yeah, close the tabs, don't do it. But today I'm going to make sure I get one out today. So you can read all these stories in full. Whooping cough is on the rise in Mobile, Alabama. This is something that's not good. It's something that we're seeing happen in many different places. And last year, it says there were 15 cases of pertussis in total across Mobile County. So, yeah, it's really a theme. Like I say every time we see one of these stories, it's a theme. We're seeing it happen all across the U.S. We're just confirming it in more places now. Flu deaths outpace COVID for the first time. Level ranked high in Georgia. This is something we heard about last week. And now we're hearing that Georgia is doing pretty bad for the flu as well. They're still at high. It's not very high, so it's better than very high. But hey, high means there's still a good chance that you could enter a risky situation where you could encounter someone with flu. And they're saying this is one of the worst flu season in decades, or in a decade in Georgia. Moving on to this now. There's an unknown illness going on in Congo. Yeah, get this. Unknown illness kills more than 50 people in part of Congo with hours between symptoms and death. So it's sounding like it's really a short period between the time they're getting this and the time they're passing away. The outbreak began on January 21st, and 419 cases have been recorded, including 53 deaths. So this is something that is obviously not good. We'll continue to keep an eye on this. There's been a lot of mysterious illnesses coming out of that region. So this is not the first time we've seen something like this pop up there. Again, I will be doing a thread today with all of the stories that you're seeing here, so you can read them in full. If we read each story in full on video, my videos would probably be about an hour long. Bird flu impacting over 600 birds on Butler County Farm. This is in Pennsylvania. Yeah, Pennsylvania, my state, is no stranger to bird flu outbreaks either. They have been happening here, and unfortunately, we're seeing another one pop up now. And we're seeing them pop up at farms. We're seeing them pop up in various different wild birds. This is not good, and this impacting 610 birds at that particular farm. All right, going international for a moment to New Zealand. Here's their cases and COVID update. New case average, 87. Rats uploaded average, 171. Cases in hospital as of midnight Sunday, 83. Cases in the ICU at midnight Sunday. It always is blank for some reason. They added 1 death, and their total deaths is 4,577. Current situation, cases reported, 700. Reinfections, 481. Reinfections, last 90 days, it says 7. Don't know. I think that when it says reinfections up above, maybe that means total. I honestly do not know why there are two different counts for that. And it says outcomes since first New Zealand case recovered, 664, and it's in the last week. And it says deceased in the last week, 9. So I'm assuming this means 9 passed away in the last week, because again, we just went up here to this 1. So we do see here there's a 9 here and a 1 there. We're going to take it that 9 passed away in New Zealand the last week, but hey, I could be wrong. All right, moving on now to Canada, where avian flu outbreak is detected on a poultry farm north of Montreal. And yet, Canada, it's spreading as well, and they have been seeing several outbreaks. So this is not good. And it says there have been 58 locations with avian flu detected in Quebec with, wow, 1,465,500 birds impacted, according to CFIA. Yikes, that is not a good number. And taking a look at Canada, let's see if the viral activity levels updated today. And hopefully there's an update. Oh, there is. COVID-19 is moderate. Flu A is moderate. Flu B is moderate. And RSV is high. So one of these did go lower. We're not seeing as much high. RSV, though, is still high at this time. Alrighty, I do have to show you the website because I did make a change. There was a news story that was put out yesterday. It was up in Boston, Massachusetts, that flu patients in Massachusetts, they were seeing some, in children, they were seeing some who were going on to have seizures. I got to be honest with you, I did not know that could happen with flu. And probably the reason why we're seeing it pop up now, it's not something that is very common from what I am reading. And it's likely showing up more now because there has just been so many flu cases this winter. So in lieu of me not knowing that, I started thinking, you know what? Flu can do more things than we know about. We know COVID can go on to cause all these different things. Lung problems, heart problems, brain problems, diabetes. On and on you could go. Flu can as well. And you know what? I had to add a new section down here. Where it says other viruses, we have influenza. Underneath that, I now added influenza studies. And I will go through influenza sections, see if we have any that should be added into the studies. And hey, if you're someone who's a member of my site, or if you want to sign up and you know of an influenza study or something, go ahead, post it, add it. I just ask that you post when the study was published, and of course put the source in there with the link to the study, and go ahead, post it. I think we need to be documenting that as well, because influenza can go on to cause new health problems like COVID. Not as many or not as frequent as COVID, but much like it, it can cause a whole range of different issues, and I think we should have studies being archived on that. Who knows? It could become a big archive, much like the COVID studies archive. Datareport.info is my website. Anyone can register for free. It will always be free to make an account on my website. All right, taking a look at what's going on with air qualities around the United States, and you're going to see there are a few areas that are dealing with bad air qualities today. The West Coast still, California, and right along the immediate Pacific Coast. Over the Great Lakes, there's a couple issues, and then you could go back across portions of New York State, eastern Pennsylvania, New Jersey, New England in general, the Northeast. And then again, it picks up around the Carolinas, but along the coast, Virginia as well, Georgia, and even along the Florida coast, there are some problems along that Atlantic coast. So some air quality issues going on there. Taking a look at what's going on in Florida, and we do note this. Not one, not two, not three, but 4 sick person calls right now. Oftentimes, there's a lot of sick person calls in Pinellas County, Florida. This is near the Tampa Bay, Clearwater area that we are referring to here, and we can see there are some other problems ongoing at this time. Taking a look at what's going on with Philadelphia for Monday. That is not Monday. Let's get Monday up there. 809 EMS incidents were reported in Philadelphia on Monday. Hopefully now we can get an update on the flu levels in Philadelphia. And we did not get that data in today, but we did get somewhat of an update from Pennsylvania. I'll show you that in just a moment. Taking a look at what's going on in Montgomery County, Pennsylvania. And you will note here, we do not see cardiac arrest listed during today's recording. That is a good thing, but we do see in Hatfield Township, Montgomery County, Pennsylvania, there is stroke showing up right now, so that is never a good thing. And we also do see cardiac emergency and a few respiratory emergency calls showing up as well. How about Chester County? Can we go a full day without cardiac arrest being reported during the update? Well, yes, we can, but I'm seeing sick person 3 times, and look at that, multiple strokes. I hope we don't start seeing a theme where a lot of people go on to have stroke now. Ooh, let's hope that's not the new replacement for cardiac arrest calls during these updates. Taking a look at what's going on in Pennsylvania, and there are several hospitals that are dealing with issues with the emergency department. There was a news story that was out, and I did not include that today. But South Central Pennsylvania, the emergency departments are getting hit very hard. We have seen that here. Better late than never for that story, but we saw that back in January and the first part of February, where South Central Pennsylvania was getting hit really hard in the emergency department. Southeast Pennsylvania, yeah, still a lot of yellow hospitals there. And Northeast Pennsylvania has a few yellow hospitals as well, indicating there are some problems in the emergency departments. And take a look at this. New Jersey has 1, 2, 3, 4, 5, 6, 7 hospitals with problems, and there may be more. Nope, just 7. So, yeah, and we can see here, full emergency department divert, total divert. Yeah, there's diverts going on right now, meaning things are really busy. And once again, Princeton Medical Center is on the list. They seem to almost always make the list for just patient volume. Wow, there's real problems going on there in that particular area. All right, taking a look at the Pennsylvania update for today. We'll start with COVID. And LP.8.1 is the leading COVID variant in my state of Pennsylvania. And that is currently listed at, I believe it is over, let's see, 23.79%. That last updated on February 8th, though. So that is a little bit behind. Taking a look at what's going on with COVID wastewater levels in Pennsylvania. And I'll see if we can't make this bigger for you to see. And you can see here, the last update, that is the last update down below. hang on, let me put myself in the center. There we go. You can see the last update. The levels in Pennsylvania for COVID wastewater have actually dropped. That is a good thing to see at this time. And now moving on here, let's take a look at what is going on with influenza across Pennsylvania. And unfortunately, when it comes to influenza, you can see here, they peaked, they tried to drop, then they kind of just stayed flat. So, yeah, not really dropping for influenza in wastewater. Unfortunately, that is not a good thing. And sorry how we have to do this, but it's the only way for me to get you to see the chart here. And we can see when we take a look at influenza, there are still some very high sites. Northwest Pennsylvania is still listed as very high, but you can see here some of these updates are pretty well lagged. Some of them are a little bit more recent. I know the capital region has been updating a little bit more frequently. And when we take a look at RSV in Pennsylvania wastewater is dropping. It's not detected. They don't use as many wastewater sites for RSV in the state of Pennsylvania. Taking a look at influenza trends, influenza activity is very high in Pennsylvania, but continues to decrease from the previous weeks. And we can see 453 influenza-related deaths in Pennsylvania. And up to February 22nd, there have been 172,271 laboratory-confirmed cases. RSV trend in Pennsylvania, it is decreasing. COVID at this time looks like they're saying it's low, but new hospital admissions for COVID-19 are still high in Pennsylvania, but are decreasing for adults and are low in pediatric patients. 839 COVID-19 related deaths for this particular virus season. All right, going on we want to go over here to emergency department monitoring because there's something, or actually no, it's hospital admissions that I want to show you. And take a look at influenza A, hospital admissions here. Yeah, wait till you see this. It is actually a really bad number at this point. We can see here, hospital admissions for adults, 3,857 as of February 15th, and pediatric, 449. I want to say that's a high number. That is definitely a high number. It's not a number that we've seen drop yet, so I am relatively concerned about that, and hopefully we will see this number peak soon now that cases are peaking, and hopefully we will see this starting to drop relatively soon. And we can see here, influenza deaths. When you take a look at the green line here, we can see that is quickly starting to rise at this point. Going back to hospital admissions for a second, here's COVID-19. We can see COVID-19 is finally starting to drop still. 1,058 adults and 38 pediatric ones. So it's still up there. Alrighty, moving on. New York State for today, 706 positive new cases reported. And when we take a look at what's going on statewide hospitalizations, some good news today. 781 people in the hospital. That number did drop. 71 in the ICU. Also a number that I believe dropped today. And when we take a look, hang on one second, let's see here. Yes, that number dropped. We take a look at New York City. Finally, maybe, look at this, maybe New York City's finally peaking. I hope we see this number to continue to drop. 330 people in New York City in the hospital, 41 in the ICU. Taking a look at what's going on with Virginia today. Overall, the virus activity level for respiratory viruses is moderate and trending down. COVID is stable. Emergency department visits for influenza is finally trending down as RSV is stable at this time, but RSV is really low at this point. Taking a look at some Walgreens data, and this is we'll take a look at the national first. COVID-19 is a 12% positivity rate. That was up by 1.1% this week. Total tests, 6,781. That's down from 8,636. Taking a look at Utah, the positivity rate is 7.7%. We're just going to read off positivity rates here. Montana is 12.5%. You can see here this chart. Yeah, Montana's got some issues with testing. Arizona, 9.9%. Yep, that was up slightly. New Mexico is 7.3%. Colorado is 8.4%. Nebraska is 11.4%. And yeah, you had a big rise there, but your testing went down. Michigan is 15% at this time. Tennessee is 15.1%. And Georgia is 16.8% at this time. All right, let's take a look at some hospital capacity levels if we can. And I'm pretty sure I had that queued up here. Yes, this is what I wanted to show you not that other page that I just had up. And we can see nationally the hospital capacity level currently, percent of beds being used is 76.4%. And when it comes to the ICU at this time, it is 74.7%. So this actually did come down a little bit. That's some good news. Now let's take a look at some other states. Let's go up to Michigan, shall we? How much of your hospital beds are you using? 76.7% for you when it comes to inpatient beds. And when it comes to the ICU in Michigan, you are currently using... that went up a little bit. Your usage is at 80.5%. So that's not a good thing. Let's go out west a little bit further. Let's see what's going on in South Dakota, shall we? And in South Dakota, currently, you're using 71.2% of your beds. And South Dakota, when it comes to the ICU, let's see what's going on there. In the ICU in South Dakota, that's currently 56.1%. You're actually doing really well with capacity for the ICU. Can we take a look at Puerto Rico? There's a question. We can. Beds being used in Puerto Rico at this time. Currently at 53%. How about the ICU in Puerto Rico? Can we see that? Let's find out if we can. Looks like we might be able to. Puerto Rico ICU usage, 71.4%. And let's also go out west a little bit further. Let's go to Utah. And in Utah, for bed capacity, 66.6% is being used. That's not bad. And taking a look at Utah when it comes to the ICU, Utah is currently at 63.8%. And let's do one more state before we go to one place for wastewater. How about Nevada? What's going on in Nevada? Your hospital usage is 74.1%. And when it comes to the ICU, your hospital usage in Nevada is currently at, let's see here, hopefully, went up a little bit, 70%. That's not terrible. I don't start really getting concerned until it goes over 80% usage for the ICU and for bed capacity. So when we see a state over 80%, that's when I get concerned. And we only saw one with that issue today. All right, briefly taking a look at a wastewater site, and given we gave a lot of attention to the Northeast, I think we should go out to the West Coast, and I think we should do a checkup on what's going on with the Eastern wastewater site in San Francisco, California. It's time. And uh-oh, why is COVID going up here? Looks like COVID's starting to go up at this wastewater site. Once again, RSV also seeing a rise. Influenza A is holding steady now, still listed high. COVID was medium, and RSV was low. Influenza B is really starting to rise now. It's still listed at low. Should this continue, that categorization may go moderate or maybe even high. As we can see, there has been a consistent trend upward throughout the month of February. HMPV has also trended upward. EVD 6.8 is low. Norovirus still listed high, not really rising at this point. Hepatitis A, some detections. Mpox, Clade 2. There was a detection back on February 3rd. Alrighty, folks, that does it for today's virus update. Once again, a reminder, you may see our update come in a little bit earlier tomorrow because I do have that telemed appointment later in the afternoon. If you enjoyed this update, give it a thumbs up. Subscribe down below if you're new to my channel. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.